Okay, I think we're going to go ahead and get started. Okay, thank you everyone for joining us this morning. This event is called Contacting for Change, our 2021-2022 co-sponsorship drive, sponsored by the Office of Government Relations. Next slide. We have a full agenda today, but we're going to do it in a shortened amount of time so that we can get to the most important part of this event, which is actually our advocacy action. So we're going to start with an overview of filed legislation for the current legislative agenda. So what you're going to see is our current legislative agenda in full, which can be found on our website, and the link will be put in the chat. But you're also going to find bills that have been actually filed in the state legislature that you can take action on today. So you'll hear from a couple of folks on the GR team, and you'll be seeing both the actionable items and the larger state legislative agenda. Then we're going to talk a little bit about story banking and how you can add your personal experience, your work experience into these conversations with legislators and their staff. Then we're going to have an advocacy action, and then we'll have some time for questions. Next slide. So with that, I am actually going to turn it over to Shannon Moore, who's our Director of State Government Relations, to give a quick overview of where we're at with the legislative agenda and talk a little bit about her corner of the legislative world. Shannon?
Thanks, Jamie. Again, I'm Shannon Moore. I am the Director of State Government Relations at Boston Children's Hospital. I'm unable to start my video. I don't know if one of the moderators can start it, but I will continue on anyway. So we're going to talk a little bit about the full legislative agenda and then kind of break down some of the places that we're going to focus on today. So next slide, please. So this is a snapshot. You may have seen it before if you were on any of our previous webinars. This is the four categories of advocacy that we're focusing on this legislative session. We're doing a bucket on healthcare access, which is ensuring that folks have access to health insurance coverage and mass health coverage, telemedicine. We're looking at the social determinants of health and health-related social needs. As you can see, there are all kinds of different issues involving housing and transportation and education. We're also looking at racial equity and social justice legislation at the State House for kids and parents and young people involved in the juvenile justice system. And we're also looking at behavioral health on here. And so what we're going to do today is kind of delve into some of the bills that match up with these categories so that you can contact your legislature representatives and senators to reach out and tell them why these issues are important to you. So we'll do the next slide, please. So healthcare access, again, just to frame up the topic, Boston Children's Hospital is committed to ensuring all children have access to quality, affordable, and geographically appropriate healthcare. And we define health disparities as plausibly avoidable systematic health differences adversely affecting economically or socially disadvantaged groups. Next slide, please. So what legislation do we have that ties into healthcare access? As many of you know, the governor has signed into law a bill that would expand telemedicine access beyond the state of emergency that we're currently in. And what we want to do as next steps is to ensure that that telehealth is being accessed equitably for folks throughout the state. So we are asking the legislators to sign on to a bill relative to telehealth and digital equity for patients, filed by Senator Gomez and Rep. Golden. And this bill really asks the state to take action to bridge the digital divide in telehealth services, which happens when families and kids don't have access to reliable internet or the technologies that they need to get these services, and also, or just maybe not a familiarity with using these technologies when they are available. And this also asks that the state take action to give interpretive services to patients that have limited English proficiency, and for patients who are deaf of heart and hearing, so that will all be covered by insurance and hopefully bridge some of these gaps that we're still hearing about in terms of folks trying to access healthcare through telehealth. We're also looking at legislation to co-sponsor called an Act to Ensure Equitable Health Coverage for Children with Disabilities. This bill expands Mass Health Common Health coverage to children and low-income young adults with disabilities whose only barrier to coverage is their immigration status. We feel that this will really cover a crucial group of kids who are just unable, they would otherwise qualify for Mass Health if it were not for their immigration status. We believe this is an important access issue. Okay, and we'll do it to the next slide, please. All right, so the next area of focus that we're looking at is the social determinants of health and health-related social needs. I won't read this whole slide because I know we are short on time today, but we have defined social determinants as the circumstances in which people are born, grow, live, work, play, and age that influence access to resources and opportunities that promote health and achieve health equity. And the things that come along with this are listed in the last bullet there, such as food insecurity, housing instability, and lack of transportation that all have gaps that impede a family's health and well-being. Next slide, please. So what legislation are we looking at to address these issues? Senator DiDomenico and Representative Vargas have filed a bill that would require, that would guarantee universal school meals for all students. Would be breakfast and lunch for all kids at no cost to the family. This bill directs schools in the state to leverage existing federal and state resources to increase access to healthy foods for the 1 in 5 households in Massachusetts that are food insecure. A lot of cities and towns are already doing this. But we think that this would go a long way to ensure that kids are well fed and ready to learn and have access to food that they might not otherwise have access to. The next bill we have on here is called an act, previous slide, an act to streamline access to critical public health and safety net programs through the Common Application. This bill is filed by Senator DiDomenico and Representative Livingstone. This bill directs the state's Health and Human Services Secretary to take steps to allow low-income applicants and recipients of Mass Health and Medicare Savings Program to apply for the federally funded Supplemental Nutrition Assistance Program, which is also known as SNAP benefits, as the same time as their application or renewal for Mass Health, kind of taking some steps out of the process to apply for benefits. Next slide, please. We are also looking at bills that will look at racial equity and social justice. We know that racial equity is the creation and proactive reinforcement of policies, practices, attitudes, and actions that produce equitable power, access, opportunities, treatment, and outcomes for all people, regardless of race. So we are looking at legislation that will uphold this value and integrate racial equity into our policy agenda. Next slide, please. So we have identified a couple priorities here. We have an act relative to expanding equitable access to maternal postpartum care. This bill extends the time that parents would be eligible for postpartum coverage, which is currently limited to 60 days. To 12 months, so that mothers can get important post-coverage services and care in that kind of critical bonding time with their babies, and make sure there's continuation in services from the time they give birth through the year after birth. And the next legislation that we're looking at is called an act providing guaranteed minimum income to all Massachusetts families. This program would create a guaranteed minimum income, by enhancing the state's earned income tax credit to cover more households, and basically puts more money in the pockets of folks who need them. Next slide, please. And I'm going to hand it over to Amara to talk a little bit about our behavioral health policy.
Thank you, Shannon, and good morning, everyone. My name is Amara Azubike, and I'm the Director of Behavioral Health Advocacy and Policy here at Boston Children's. Next slide. So to frame up our behavioral health agenda, wanted to make sure that folks knew what our commitment is in the behavioral health space. We are committed to ensuring access to timely and high quality behavioral health care for children and adolescents across the full continuum of care. And behavioral health encompasses the promotion of social and emotional well-being, but also includes the treatment of mental health conditions, substance use disorder, developmental and behavioral challenges, and trauma-related health conditions. And so as you can see, we also support culturally relevant and equitable models of behavioral health promotion, prevention, and intervention services. Next slide, please. And so I'll quickly go through this so that we can get to the main event, which is advocacy around these really important pieces of legislation that will hopefully increase access to critical care, especially now during, the COVID-19 pandemic and how that has impacted behavioral health for many children across the nation and certainly in the Commonwealth. So first is an act relative to child ED boarding, and this would facilitate the creation of a publicly accessible web portal with real-time data on children who have waited 12 or more hours after being assessed to need acute psychiatric treatment, and would also do something really important, which would establish a complex case resolution panel to resolve issues regarding access, particularly when there are multiple agencies involved in the patient and child's life, to make sure that the kids are getting the care they need where they need it. An act relative to behavioral health urgent care, and this would require DPH to develop regulations for urgent care centers that have been popping up, including requiring such centers to provide behavioral health services so that kids can access the care in their communities. And then finally, an act to create a thriving public health response for adolescents, what we're calling the Thrives Act. This would establish systems and protocols for the creation and maintenance of school-based behavioral health resources to ensure that all students have the care they need when they need them. And next slide, please. Yep, so I'll kick it back over to Jamie.
Thanks, Amara. So with that, we're going to open up the chat box and see if folks have questions about the specific policies they heard about today for either Shannon or Amara. As a reminder, you can type your questions into either the chat box or into the Q&A. Not seeing a ton of questions. Amara, I have one question for you. I'm seeing that someone raised their hand, but we actually don't have the ability to answer hand raises. So if you could go ahead and just type whatever question you have into the box. One question that was submitted along with the registration, Amara, is where can we find the full Children's Mental Health Campaign legislative agenda, understanding that they work on things sometimes beyond the scope of Boston Children's?
That's a great question. You can go right over to their website, to the children'smentalhealthcampaign.org, and I will put that in the chat for folks.
Awesome. And this next question is for Shannon. When will these bills go into a committee for public hearing, and when should we be submitting testimony?
That's a great question. The bills right now are currently, so they just appointed the committees last month, so that's all available on the masslegislature.gov website. The committees right now are in the process of setting up hearings. It's going to look a little different this year because they are unable to do things in person. I would say all committees take testimony on a rolling basis in terms of written testimony. So if you are unsure when a hearing is, you're always welcome to email your testimony along. Otherwise, you can find out about when a bill is going to be having a hearing by checking the website and or checking in with somebody on our team as well. It should be over the next few months, I should say, for that kind of timeline.
Awesome. And I know that we are in the Office of Government Relations thinking critically about how that folks can submit testimony, understanding that most of these hearings will be done virtually. So stay tuned for that. Check out on our new GR website, which will have an advocacy section where you can go and learn more. You can always reach out to our office as well. I have a question in here about Mass Health PT1 coverage for youth connected with Boston Children's Behavioral Health Services. Amara, is that something that the Children's Mental Health Campaign is looking into?
I don't think that we're looking into that right now, but I'm happy to talk with whoever submitted that question offline to get them the answer that they're looking for.
Thanks, Amara. So what we'll do is we'll post everybody's contact information afterwards. And if folks have specific questions like this, they can certainly reach out. And then the last one is, oh, sorry, I'm just trying to read them all as they come in. The next one is about it seems like behavioral health services specifically for inpatient and CBAT services that Amara is going to go ahead and answer in the chat. So thanks, Amara. With that, I am going to transition over to the second part of our not of our Q&A, but of our presentation. So thank you to Amara and Shannon for all of your work and for helping us understand these policies a little bit more.
Thank you, Jamie.
Alexia, I'm going to have you go to the next slide. And one more. So now that we know all about the policies that we're working on, how do we go ahead and move up the ladder of engagement to the next steps? And so where we are in terms of the legislative process is we need sponsors and co-sponsors to join on to our legislative agenda. So I like to think of sponsors as the head cheerleader for a bill. They're the person that signs their name, that files the bill, that is really leading the charge when it comes to the State House. Co-sponsors are other legislators that sign on in support of a bill. And it's really important to have co-sponsors, just like it's really important to have a robust cheerleading squad. You want to signal that there's a lot of widespread support. So as a bill moves through this process, and as you see on the slide, this is what we refer to as the game board of the legislative process in Massachusetts. We want to make sure that there are friends of the bill kind of across the whole process so that folks understand the importance of the different bills. Next slide. So I mentioned the ladder of engagement. What is the ladder of engagement? Well, it's good to know that you're all already on it. These are different actions, advocacy actions that you can take to make sure that the legislative agenda and the policies that you care about make it across the finish line. So we're all starting with education actions, which is what you're doing right now. You're coming in, you're learning, you're understanding the policies. The next step is going to be an easy action, which is going to be to sign a petition or forwarding a form letter, story banking, moderate actions, and complex actions. What we're going to be doing today is somewhere in the easy moderate action, depending on how comfortable you are with email. Next slide. One more. So let's talk a little bit about story banking and what this means. What is story banking? Well, it's the understanding that you're going to take your experiences and you're going to be able to translate them to elected officials. Most elected officials are lawyers by training. Many of them have never been inside a children's hospital and certainly don't have the firsthand experience that all of you on this call have. So stories are really good because they humanize a political issue. Think of any policy issue that you've been interested in. When you hear the human side of it, all of a sudden it doesn't just become about the data and the money. It really becomes about the people that are going to be impacted. It depoliticizes content, so it can take an incredibly hot button issue and turn it into a human issue. And it also teaches others what they may not see on a day-to-day basis. There are many people that might not understand what it's like to raise a complex child or deal with emergency department boarding or the importance of telemedicine for a GI family. You can help legislators understand that the policies that they're working on impact real people and that you have seen the real problems and solutions that policy can bring. Next slide. So what we're going to do right now is Alexia is going to put into the chat a link that you can use to contact your elected officials and ask them to co-sponsor a variety of Boston Children's bills that you heard about today. So remember, Alexia, I think I lost my slides. There we go. Remember, you're going to be most effective when you're contacting your elected official because you are a constituent of that person. A constituent is someone that lives in the district and votes for that elected official. So how are you going to take action? First, you're going to visit the link that Alexia is putting into the slide. Then you're going to type in your information into the system to be connected to your elected official. We've taken out most of the hard work for you. What you're going to do is you're going to get a form letter that pops up. What I want you to do is edit the information with edit the letter, sorry, with your information and your personal story. What's your connection to it? Is it that you've seen firsthand the impact that telemedicine has and you want to start working on equity? Is it that you understand if you work in primary care, that SNAP is sometimes the only thing that's keeping our kids fed and you want to make sure we have a common application? Whatever it is, put your story into the letter, because those are the things that really help differentiate between a form letter and a personalized letter. Then you hit send. If you have any questions, you can reach out to us at can@childrens.harvard.edu. Alexia and I are here all day. We want you to do this. We want you to send it to your colleagues. This recording will be shared with all of you after, along with the slides and the link. Please send this link wide. We want Boston Children's Hospital to be right on the front lines of advocacy, and advocacy from the inbox is one of the best ways that you can get organized during the pandemic. With that, I will pause to see if folks have any questions about contacting their elected officials or anything that we've talked about today. And someone said, can you add that into the chat? I think that they mean the co-sponsorship link, which I believe Alexia has added into the chat. The take action now, yes. So that is going to be added into the chat. Right now, it came through with Alexia. It says advocacy action contacting for change. You can click on it and go ahead and take it. And yes, Renee, it is about as easy as it can be. So not seeing any additional questions in either the chat or in the thing, we will let you all go 8 minutes early so that you can contact your elected officials. Please let us know if you get a response. Please let us know if you have any questions. We are here to help. And with that, I'm going to have Alexia advance to the next slide. And one more. This is our contact information. You can reach out to any of us. We are here to help. We're here to support your advocacy goals. And we thank you so much for your willingness to engage in these topics during these challenging times. Thank you for joining and good luck with your advocacy.